Hey everyone, what's happening? We are trying to get Dr. Schuler on here. If everyone can see us and hear us, okay, just give us a quick hello on the side.
Hey everyone. Yeah, he's at the Expo West conference. He's just trying to get his stuff hooked up right
Yeah,
now. There
yeah,
he
there
is,
he is. There's it.
I think.
Yeah, I think he's coming on. I think he's coming on. Can everyone hear us? Okay. Hello, hello, hello. I have a feeling.
Is the chat
I'm
frozen?
not sure. Hi, thank you, Ada. Elizabeth, hello. Okay, cool. We're coming through.
I don't see anything in the chat.
You don't again?
Nope.
Did
Mm-mm.
you press the wrong button again when
I
you
at
logged in,
least
Michael?
have the chat this time, but I don't see anything in it, so
Okay, yeah, they're all pouring in. Cool. All right. Hey
cool.
everyone.
All right. Hey,
Hello from Arkansas.
we've got
All right, so Corey's starting to come in, but we can't hear or see him.
it says failed to go live in the upper right corner. We're still trying, but then it says live.
Okay, that's scary. Well, we must be live because people are here and saying hello.
All right. So
Cool.
I don't see any of the questions though.
No, well, there's no questions yet. It's everyone just saying hello. So hello, everyone.
Cool. Well, let's introduce Corey.
Yep.
For those who didn't see, you interviewed him. You introduced him.
Okay, yeah. So Dr. Corey Schuler, um, is expert on hormones. Particularly, the interview we did was specifically about male hormones, but he's pretty much an expert on all hormones. He also runs a headache clinic, which I think is really interesting. So if people have questions about headaches, we can get into that too. He's a super cool guy too. We had a lot of fun doing the interview. Surfboards haven't moved since last time. Micah, you guess you haven't gone surfing, huh?
No, I haven't stopped working enough to go surfing.
Yeah.
Um, Not today. It actually rained 2 days ago, so it's not really that safe to go in the water here 2 days after a rain.
Hmm.
There's bacterial issues and stuff, so
Oh,
there's
that's not
no.
good.
Yeah, one of the most well-known local surfers died in December from a staph
Really?
infection.
Yikes.
Yeah, there's the San Diego River is about I think it's called that. I don't know. A big river that feeds into the ocean is like across the street, and when it rains, a bunch of stuff goes in the river, and then it goes into the ocean, and then it's poison for
Yikes.
surfers. Luckily, it doesn't rain very often, but when it does, we stay the hell away from the water because I don't want a staph infection.
Yeah, that's nasty stuff. So Corey sent me a message saying that he's in, but it won't let me on. Uh, I even joined. It times out. So he might be here. He might be able to hear us. So nobody say anything bad about Dr. Schuler. um,
I see his picture in the corner.
yeah.
All right. Well,
Good. I'm going to keep working on this. You can say
oh
things,
yeah,
Michael.
we're gonna try to focus on. We don't have to keep it to a certain topic, but his interview was on testosterone and men's health and hormone therapy, and he also works at a headache clinic. Is really knowledgeable on that stuff, hormones, anything. There probably isn't a topic or field that Dr. Schuler can't handle or field questions on. So we do want to try to keep somewhat of a theme of men's health through the questions, but anything, I think anything's pretty fair game.
Hmm.
So if you want to start throwing questions up, Joe, is there something I can do on this end? Is our situation different on the screens, mine and yours?
No,
Just
it's all the same. Sorry, folks. Sometimes Google Chat just doesn't like us.
yeah, as we learned last night, but last night was super fun, so
Yeah, last night was good, and that wasn't a
worked out
Google Chat
awesome.
thing. He just had a really sketchy connection. So,
There, he just popped up again. Corey Schuler joined this.
there we go. Corey, can you hear us?
Hello, guys.
Hey, how's it going?
Hey,
Cool.
Can you hear me?
yes, we can
Supposed
hear
to
you.
happen.
Awesome. Are you up in
Awesome.
Anaheim?
Uh,
Yes.
Hold on. Should we adjust his bandwidth down a little?
if yeah, Corey, if you on the top if you hover over the top of the screen, there's a pull-down menu. If you hear this, there's a menu that kind of pops up that you can adjust your bandwidth. It's like the middle, second from the right icon. So maybe if you adjust down your bandwidth, it might come in a
Because
little
the
bit.
audio is choppy, so it usually gives a better audio, less video quality, which is fine for right now. Cool. All right. Well, welcome. How's the convention going?
Hmm.
I don't know if he can hear us.
I think he could probably hear us, but our connection's really bad. I think he's in a hotel too, like Karan was.
Okay, we'll start flowing the questions in. As soon as he gets himself hooked up, we'll start jumping on him.
Mm-hmm.
Corey, can you hear us?
What time was that?
Yeah, you're pretty choppy, but we can kind of hear you.
Okay. I've adjusted bandwidth.
Okay, wait a minute. I think we're getting somewhere. Did you turn down the bandwidth?
Yeah, I turned it down as far as it'll go.
Perfect.
No, that audio is perfect. Great.
Awesome. That's what we need. Cool.
How about that?
What city are you in?
I'm in Anaheim.
Okay, how's that convention going?
Good. Today is setup day, so it was, CEOs of natural products company in their T-shirt and jeans. It's kind of cool to see people putting up their booths and kind of, hobnobbing. It's neat.
Cool.
Very
well,
cool.
Thanks a lot for hanging out with us and spending some time here with the good folks of Primal90. We should probably jump right in since we're running a little bit late. Let's see here. I'm going to get past all the surfboards and comments. Someone has a question about headaches. I don't know what this is. Broken glass? Broken glass look through the eyes before migraine. Broken glass, so I guess it looks like you're looking through broken glass. I know, Corey, you help run a headache clinic. So any thoughts on having that sort of looking like you're looking through a broken glass before getting a migraine? I think we're having some serious difficulties with Corey's connection. Sorry, folks, we're working on it.
Do you got any questions on there about? I wish I could see them.
So you can't see any of the questions, Mike?
I see nothing in the chat.
Did you click on chat, like
Yep.
the chat button on top?
Oh, maybe enable chat box?
Yeah, try that. That would work.
Okay. Perfect. Let's see. Audio's great. Audio's great. Golden. It's actual.
All right, that sounds like Corey's coming on again.
Hear and see fine. I don't.
We've got some great questions.
I can go into Joni's question. Corey, are you back?
I can hear you guys.
All right.
Okay, we can hear you.
We're gonna try one. Somebody mentioned right before getting a migraine, or before they get a migraine or before they get a headache, it looks like as if they're looking through broken glass. But I think she says that she starts getting that broken glass sort of vision, but then doesn't get the headache. What's going on there when it looks like you're looking through broken glass?
Yeah, that's part of the prodromal period of migraine. There's sometimes visual component to it.
Mm-hmm.
Everybody experiences a little bit differently.
Yeah, it's you're breaking up there. I'm
You
sorry.
can you hear me?
Yeah, on and off, Corey. It's the connection's pretty bad.
Okay.
Is there a way we can hook him up
Okay.
just audio?
Um,
Oh wait, there.
yeah,
All right.
Corey, see if you can turn the camera off maybe and see if that helps. Not that we don't want to see you, but
It seems to be doing good now. So
okay.
let's do Joni. I get helping the adrenals by blood sugar control, sleep, etc. But how do you heal the HP axis?
Yeah, it's complex. You guys can hear me all right? This is all
Yep.
right?
Yeah, yep, we can right now.
Okay.
Yeah.
Um, terribly complex question. I'm turning the camera off to help with bandwidth.
Okay, cool.
I think it's helpful to kind of understand what the HPA axis is first.
Right.
So the HPA axis is really the interface between your body, and the environment. And so there's a lot of feedback mechanisms, and so there's never one thing that's like, yep, this is going to help heal that. If a lot of times natural medicine practitioners will look at cortisol levels as sort of a good indication of HPA function or dysfunction, and that's an okay measure, but it's better to be looking at a few different markers. If an HPA axis is under functioning, you really have to support that negative feedback loop. And so what I mean by that is that hypothalamus, I wish I could use my hands when I'm describing this, I always use my hands. Think about like a coffee filter, right? That big, like a coffee filter, you know, those things that we had before people used Keurig machines. And that hypothalamus, it takes in information from the outside world as well as the circulating tissue of the body, and then just distills it down to the pituitary gland. Now, when somebody has really late stage HPA dysfunction, the HPA isn't listening anymore. It's like taking that coffee filter and like wrinkling it up, so or it gets on the outside, doesn't go through the coffee ground. It's a total mess. It's a nightmare. What we see is that not only that is that the adrenal cortex, where we're really talking about the producer of cortisol, that's not listening anymore. So I'm only going to talk about it in people with like late stage issues. You really have to rejuvenate all of those tissues. So things like licorice extends the half-life of cortisol, so that's generally a really good thing. But one of the things that's incredibly underserved, doesn't have great public relations, I guess, is B6. B6 can actually help better, and that's incredibly important, because if it's not listening, then, well, it's kind of like we've talked about insulin resistance and things like that previously, and we always talk about insulin sensitizers. We can actually have sort of a sensitization effect with B6, and so that's actually one of my top dogs for that, because it's water soluble, relatively safe, and so I would be talking about B6 primarily for that, and then there's probably some other herbs I'd look at as well.
Hey, do you have a preferred form of B6? Do you mean like P5P?
It depends. That's funny. You know, a lot of folks, especially those of us who are looking at like Pyrrole disorder, we find that respond better to P5P or PLP, and some people respond better to the inactivated form of B6. So what I do at first is I do a combination of the two, usually at like a 10-to-1 ratio. So if I'm going to give 300 milligrams of B6, which is a lot, by the way, some people get side effects from that. Yeah, I'll give 30 milligrams of activated B6.
Okay.
Cool.
Cool. Thanks.
Let's see here.
I've never heard the coffee filter analogy with the HPA axis, and that kind of helps make a little sense out of a super complex topic.
You want to tackle this one from Deb? About her husband's intermittent headaches?
Yeah, my husband has had intermittent headaches, and all the nasties have been ruled out, tumors, etc. And the neurologist diagnosed it as tension headaches and want to throw a bunch of meds at him. We are now on an elimination diet to see if that helps. Any other thoughts? Thanks, Deb.
Yeah, maybe we should look at some structural components. I know a lot of chiropractors, myself included, would evaluate cervical spine and thoracic spine, but the idea here is that oftentimes this idea of upper cross syndrome happens, which takes those postural muscles. So those muscles that run between your shoulder blades, those postural activated muscles, they're
This is
super
upper
important
cross.
for tension.
I'm
What's that?
demonstrating
There you
for
go.
you.
See?
Oh yeah.
That's I appreciate that. And so most people, when you when your mom yells at you and says sit up straight, you sit up really straight. Can you activate that one? How would you sit up straight if I told you to sit up straight?
How would I sit up straight if you
Like
told me
this.
to?
Yeah. Yeah, what would you do? So that feeling, what did you feel right there? You felt your low back usually.
Low
Mm-hmm.
back
Your low
arches
back
a
is
little
that thing
bit,
that
shoulder
Yep.
blades come
yeah,
together.
you arch your shoulder blades, and yep, and then it's sort of like an afterthought. The shoulder blades come together, but those shoulder blades coming together is actually really important. This is a super simple fix. If you take like a tube or a band in front of you, so you reach out like you're a zombie, and you grab tubing on each hand, and you stretch it out real hard. There you go, stretch it out,
Mm-hmm.
and then you pull it to your chest. Just hold it to your chest, though, because you're not strengthening those muscles necessarily. You're just activating them, and you
Right
can
here.
feel those muscles between your shoulder blades kind of twitching and being all active. And then
Mhm.
what I would do is say, now that you've got that in position, now take your neck into a range of motion, both total flexion, total extension, turn to the right, turn to the left, and do that motion a few times.
Mm-hmm.
And then once you got that going down, then kind of relax and let go of the tubing and stuff, and see if you can sort of retrain yourself, retrain those postural muscles to work a little bit better. Oftentimes tension headaches, and when everything's ruled out like that, that's the first thing we look at.
Excellent. Excellent. Yeah. I think when he started saying that, everyone in the whole room just stood up straight.
Yeah.
I did.
It's like Chad and Brenda's video from Sitting
Yeah.
Still. They talked a lot about different exercises you can do, for 5 minutes here or there throughout the day, to kind of offset some of that stuff. But
Yeah, that was one of them, taking a band and stretching it across like this and just activating those muscles in the back. This
I
was
had
another one.
a neuromuscular therapist friend of mine who he works with a lot of headaches and works on muscles in the neck and the head and whatever, and it works for 4 or 5 days. But if they don't keep with things like Dr. Schuler just said, with corrective exercises, things like Cobra on the ground. I don't know those who know yoga, but those type of things definitely can be a structural thing, especially since she went through all the tests and they didn't find anything.
Yeah, right on. Cool.
Yeah, and unfortunately, a lot of physios and chiropractors might even miss that because they're concerned about, physios are usually spending a little bit more time on tissue integrity. Chiros are probably spending a little bit too much time on joint mobility, when really this is a stability motor control issue. So, just something to keep in mind, not just because you already went to a look at somebody else who's trained differently.
Cool.
You want to go to
A.
Yeah, which hormones are in... Oh, go ahead, Joe.
Which hormones are involved when a 50-year-old man is moody and easy to anger? That sounds like people I know. Okay, Corey.
Could be any number of things. I mean, it could be just an inflammatory issue. So one thing that I like to discuss is like how testosterone and inflammation are sort of like a teeter-totter. You have high inflammation, you have low testosterone. You have high testosterone, you have low inflammation. And that inflammation actually has got a lot of nice credibility, and this psychiatric community is paying attention to this about like the brain on fire, inflammation leading to depression. And depression, in one of its manifestations, is just irritability. And so that could be one of them. Could just strictly be low testosterone. Low testosterone causes a variant of kind of depression. We have it could be just high levels of estrogen. Sounds kind of odd, but it's definitely possible. Low oxytocin could be that. So oxytocin is like the hug hormone, right? And if you're not getting hugged enough, maybe that's an issue. And it's funny, and Sarah Gottfried always reminds me of this. She says that men need to be hugged 3 times longer to get the same levels of
really?
oxytocin.
How many times
Yeah,
longer?
it's
3 times longer?
3x. Yeah.
Wow. Good to know.
So when you're hugging your guy, you gotta hug him longer just to get the same physiologic effect. Apparently, I don't know where she got that, but I believe her because she's wicked smart.
Totally, yeah, that sounds legit to me.
I'll buy
Very
that.
cool.
I'll believe that.
Yep. Corey, someone asked before about that broken glass look before getting a headache, and you answered it, but it was really choppy, and I think the answer, I want to make sure that we get her that answer. Like, what is that's going on there?
Sure. Yeah. Migraine headaches almost always have like an aura or a prodromal period, and the prodromal period often has either an auditory but most commonly visual effect. So people with migraine headaches, they have to be in a dark room, they have to be quiet, all of that kind of stuff, because any kind of stimulation is really irritating to those headaches. Now the broken glass situation, that's just a variant of that prodromal period, but it's not terribly uncommon. If instead of a young like an older man, you'd have to rule out something called cluster headache. That's like an ice pick in your head, and so that would be like a combination of a migraine and cluster headache. Pretty awful stuff, actually.
Yeah. Is there a like I've known people actually get one pupil actually gets dilated and the other one gets constricted. Is that part of that same sort of area?
Yeah, totally, and that's the sympathetic nervous system reaction, and that's so the sympathetic nervous system actually one of there's a lot of different migraine causes, but oftentimes it's caused to change of blood flow, and so that's where the migraine is really coming from, but it's coming from the same source.
Got ya.
Just a follow-up to that, she said sometimes she gets the broken glass vision for about 20 minutes, but never gets the headache or migraine. So do those visual or audible effects tend to like be a precursor to the headache, and if you do the right thing or the wrong thing or whatever, it affects if the headache actually manifests, or is that random?
Headache without having a headache, which is kind of funny, but that having that prodromal period is actually part of that diagnostic criteria. So she's a migraine without a headache.
Technically, it's still a headache.
Okay.
Still a migraine.
Headaches are like one topic that I really don't know a lot about, so it's interesting. I've never really studied headaches a ton or been on a Q&A with headaches, so it's an interesting topic. I've been lucky my whole life not to really get any other than self-induced ones that I deserved.
Yeah, we have a whole practice dedicated to headaches, so we see all the different variants of it. Sometimes we don't get into the causes. Sometimes it's really clear where it's coming from and what needs to be fixed. But we always refer and kind of work with a team structure. So even though it's sort of a specialty clinic, we're still getting the opinions of other people. So we hear a lot of like everything's already been ruled out. We don't know what to do. That's sort of our primary patient.
Any sort of natural supplements that are effective for headaches?
Yeah, there's one that we really like called.
Wait, hold on one second. Can you start that over? Really scrambly.
Yeah. Try that again.
Really, what I like a lot called butter.
Nope, didn't catch that.
Okay. The one that I really like is called Butterburger.
It sounds like Butterburger.
It does sound like.
I think you had mentioned that also during our interview for Barberary.
Maybe.
Are you saying berberine herbs? Because it's cutting out every time you say whatever the word is.
Yeah.
Are you saying berberine herbs?
No, Butterbur.
Butterbur.
You kind of were saying Butterbur.
How do you spell that? Butterbur.
Butterbur.
B-U-R. Butterbur. Okay, cool.
You just typed it in the chat.
For real.
And is that like an anti-inflammatory, or what does that do? Does it help with blood flow, or?
It's a good question. I haven't investigated the mechanism of that, but it's particularly good for migraine. So I think it's to do with with either probably the blood effect, blood supply.
Yeah. Cool. Okay. Awesome. All we need to know is that it works.
That it works.
All right. Let's move on. Any way to naturally boost testosterone with food supplements? And if you can go, I think that interview is live today. I think, right, Mike?
Yeah. His interview's up right now in the lobby, and he probably covers that. But we'll go in a little bit now. That's a pretty, broad question, but
maybe a few tips.
Yeah, a few food supplement related tips with testosterone.
Well, I don't go after testosterone directly, right? So I'm trying to fix the stuff that comes before testosterone insufficiency or so I'm looking at more of the effects of what if I have to there's a certain type of ganda that has been nice effects on testosterone, and it has other good habit for men.
Hold on, it's been really choppy since you started answering that question.
All right.
Oh, there you are. It's like when we're talking about it, we can hear you totally clearly, and then when you dive into answers, it decides to get screwy. I guess just try it again. I don't. Should we have him like disconnect and reconnect? Do you think it would be possible that it would be better, or do you think that would risk losing him?
Well, I don't think we would lose him. I think he'd be able to come back in, but I'm not sure if it would get any better. I think Corey, you're in a hotel.
Yeah, I even got the super package.
Wow,
connection speed.
Well, you sound good right now, so jump back in. Testosterone, not going after testosterone. You go after what?
I tend to go after those foundational aspects of health, like inflammation and blood sugar and that sort of thing. But if I'm into a corner and somebody is like, give me something that has been shown to affect testosterone, I can do that. Me okay?
Yep. So far, so good.
Okay, keep going. All right. So there's a type of ashwagandha that's been studied that has good effects on testosterone, and so has other beneficial effects. So I like ashwagandha for that. And there's certain types or colors of maca that do really good job increasing androgen levels, and so I like that as well.
Yeah, what would you say?
There's a lot that
I remember in the interview it was red maca or something like that, which was like I think you referred to it, or people refer to it as the man maca or something like that.
Yeah, red maca is particularly helpful for prostate issues. Actually, there's others that are that can be cultivated and blended together that seem to be doing a good job for testosterone.
Okay, cool. All right, let's see. My husband has pylorrhea. Can this have an effect on his hormones? What supplement should he be taking?
It can, but probably not. Pyrrole disorder is actually fairly straightforward, even though complicated over the years. It's just zinc and B6, and zinc and B6 at relatively high level period of time. We should pay attention to is zinc is actually a saturase enzyme system, and if zinc is insufficient, or you're using too much of it, or you're excreting it at a high level, you can actually cause inflammation. So that might be one direct causal effect of Pyrrole disorder and male hormone disorders. So that's something that I'd be paying attention to. But otherwise, I would treat the Pyrrole disorder. In fact, take it one step further. If somebody has Pyrrole disorder, they probably have a really messed up gut, whether they know it or not. And so we got to heal that baby and get it back to normal.
What's the connection there? I had Pyrrole disorder, for those who are unfamiliar. Cryptopyrroles are a byproduct that binds to, I believe, B6 and zinc, so it often leads to B6 and zinc deficiencies, and therefore, since zinc and copper are antagonistic, they tend to get overloaded with copper and have copper toxicity related issues. What's the connection, if you wouldn't mind elaborating, on the gut and that? I've never heard that before, so I'm just curious.
Yeah, yeah. I mean, we're finding that, so if there's got to be a mechanism of why somebody would excrete that at a high level, and unfortunately, there's a lot of clinical data, but not clinically studied. We haven't put this through the rigors of figuring out why. However, we've done some experimentation at the clinical level to find that if I give somebody, if I'm treating somebody for pyrrole disorder and I kind of determine their levels of zinc and B6 that they need and their other kind of co-nutrients, they usually do okay up front. Then they plateau and go down. But then if we support their gastrointestinal system, usually with things like glutamine, and we exchange the zinc out for something like zinc carnosine, and which is good for the upper GI system. We take a look at non-colonizing yeast, stuff like Saccharomyces boulardii, and really do spend some time supporting the gut. Then we actually see that plateau get broken. So people who are into physical fitness totally get, breaking a plateau. Sometimes in chronic disease we forget about that, but that's absolutely the case. So it's more of a good mechanism in place, but I do know that every pyrrole that I cross, starting with the gut.
Cool. All right, we had a good run there. We heard almost every single word you said.
Yeah, until the very end. But basically,
Yep.
like, there's got to be a component of gut disorder that contributes to the excessive production of pyrroles. I would look. Is there a brand of Butterbur that you prefer? Elizabeth wants to know.
The common one is Petadolex, and that has some of the there's a toxic compound in Butterbur, the herb itself, that has to be removed. Petadolex does that, and that's the kind of I don't know if it's patented or trademarked version of it.
Okay. Can you say that one more time? I'm going to try to type it for the chat.
Yeah, I'll spell it Petadolex.
Cool.
And they sell to multiple companies, so it might be under different brands, but it's still the same manufacturer.
Nice.
Okay.
Great.
Cool. Thank you.
Yes. I'm gonna clear that one out. Let's go. Do
you want to go?
Let's start back at the bottom and make sure we don't skip anyone.
Yeah. Bonnie's
Julie?
teaching people how to use the chat box, which thank you, Bonnie.
You want to do Julie? I think that's the next one up. Yeah.
We did.
My brother has severe tension headaches for 30 years, which put him on disability. They are constant, no relief ever, but biofeedback has helped a little. Elimination diet didn't help at all. Tried experimental drugs long ago, but nothing helped. Only option painkillers. She's asking, is the only option painkillers? Anything new available to try?
In a case like that, and it might have already been tested, but I would do red blood cell testing of icosanoids and just take a look at the fatty acid content, because this can be just a cell membrane thing, and it's often overlooked. We often think about fish oils and stuff like that as anti-inflammatory, but really there could just be a derangement of the cell membrane, so things aren't responding all that well. So that would be one test that I would look at. Or one test, it's not usually very expensive. You can do fish oil at pretty high doses, but there's a challenge with that because people don't do all that well. Speaking of people who have pyrrole disorder, too much fish oil can cause just people to not feel very good. So I would probably just do a test, and that gives you kind of a treatment plan for about 6 to 12 months. So that would be one thing I would do with that chronic tension headaches like that. The other thing that I would look at is that if there's some cranial manipulation or cranial involvement, oftentimes I find that people have been in kind of really either a car accident or they had sort of head trauma, but they didn't really have headaches at the time, it kind of comes back to bite them, and so you'll find those sutures on the skull to be super painful. The one that's right on top of the head in particular can be very painful, and then you can kind of run your hands across like above the temples. If those are really sore, I'd try to find a cranial therapist locally and probably give it, 8 sessions or so. Sometimes these things turn around really slowly, especially something that long-standing.
Excellent.
You're talking craniosacral?
Yeah, I mean, there's cranial sacral, there's sacral occipital technique, but then it doesn't always have to be a named technique either. But if you did cranial manipulation or actually just cranial, I call it cranial work, but that's probably not how we can Google it. The SOT, cranial sacral therapy is probably fine, and you don't have to find a doctor to do it. A lot of massage therapists and musculoskeletal therapists are perfectly qualified to do that.
Okay, what you said right at the beginning, you said an RBC test of, and then it got blurry for a second, and then you kept going, and we heard the rest of it, but what was the red blood cell count test that you said to check out?
Fatty acids.
Okay, a fatty acids blood cell test?
Yep.
Okay. Any functional doctor would be able to order that for them, or
Yeah.
you can order blood components yourself also and do them at a local lab. If you want info on that, shoot me an email.
Actually, we did skip one from Elizabeth, and it's a pretty interesting question. Is there sort of a map of the head so you can tell, like, if I have a headache over here or in the back, can you sort of tell the cause of it by where the headache is?
No, I wish I could.
Okay. That's easy.
Well, you figure out that map.
Yeah.
Then I'll sell it to everybody.
Exactly, the $1 million map.
Is that if you have a headache in the front of your head, they call it a frontal headache or a frontal tension headache. That's generally functionally related to some sort of biotransformation.
Okay.
This, one side or the other, also probably cervicogenic. It's coming from the neck. But the truth is, if I have to really be honest, which is how I roll, is that I have no idea. I can't pick it out. I can't describe it and be like, yeah, this is going to be from that. I almost always have to do my due diligence and a workup.
Yeah, cool. That makes sense. Thank you for that. Mike, you want to take the next one? I'm setting up a little present for everyone for the end of this.
I was just answering a question there.
I think Michelle?
Yeah, Michelle.
15 years ago, I stopped
her
taking...
again with the broken glass. 15 years ago, I stopped taking an aspirin a day.
Mm-hmm.
Wait, it sounds like she used to take an aspirin when she got the... It literally says, but 15 years ago, I stopped taking an aspirin a day when I got the headache, and they stopped, but still have the aura or broken glass.
That's really interesting.
So it sounds like she hasn't had like physical pain for 15 years, but still has the broken glass. Would you work on that as if it were a headache? Like as if there were pain?
Probably related to something else that's not blood flow related. So something like a hormone cause, or maybe this could be a pretty good one for blood sugar, but it just depends on what the person looks like, feels like, exactly. You know what I mean?
So blood sugar, possibly, would be something to look at. Blood sugar, yeah. A lot of things get cleared up when you better modulate the blood sugar. Oh, that's a good point, Joni.
Hormones, inflammation, just keep hitting the same 3.
What was the 3? Inflammation, what? We're cutting out. Hold on 1 second, Corey. Maybe it'll come back.
Sugar and hormone.
Got inflammation, blood sugar, and hormones.
Mm-hmm.
Neuroscience researcher Mark Waldman gives the following technique to lower stress levels: yawn, stretch, and then massage your arms or palms with your hands. This is more of a recommendation. I agree with that. That's all I wanted to point that out. That from Joni, you know, little stress, even a couple minutes out of every hour when you're working during the day, taking a couple minutes, breathing, doing a little self-massage, some deep breathing if you want to yawn, stretch, goes a long way versus staying in that same activated state all day. Those little breaks can be huge.
Mm-hmm.
Corey, you with us?
Not at the moment, I guess. Okay. We'll get him back.
Right. Is there anything that can help curb or counter the fight or flight driven headache? I'm going to leave the headache questions for when he comes back.
Yeah, but in general, breathing exercises. I have an app on my phone that's like a guided meditation that I could set for anywhere from 5 minutes to 30 minutes. So as a general answer to anything having to do with that fight or flight or that nervous system, I find it really difficult to just sit and meditate. But I'm really good at listening to guided meditation, and that works really, really well. Been using that a lot lately.
A diaphragmatic breathing exercise might be good for that too. And our breath is linked to sympathetic, parasympathetic nervous system activation. So fight or flight is sympathetic nervous, parasympathetic or inhalation is sympathetic nervous system activation. Exhalation, breathing out, is parasympathetic, which is calming and relaxing. So if you're going to do a breathing exercise, put one hand on the chest, one hand on the belly. The belly should come out before the chest rises. You want to fill from the bottom, fill the whole body up, breathe through your nose. If you make the exhale twice as long as your inhale, so say you inhale for 3 seconds, exhale for 6, and count those numbers in your head, because then you can't think of anything else if you're counting numbers. So thoughts can't wander. You can't be thinking of everything else while you're counting your breath. So inhale for 3, exhale for 6, inhale for 4, exhale for 8. That type of breathing, because the exhale is longer than the inhale, will stimulate the parasympathetic nervous system. I can't speak on fight or flight driven headaches specifically, but I know that downregulating the sympathetic nervous system and that type of activation of headaches, or that type of activation in general, that type of simple diaphragmatic breathing exercise, if you do it right now, there's a chance you'll fall asleep, so don't. But it's really helpful. It's really helpful when we're trying to deactivate that sympathetic nervous system. There's it's an app on the phone called Breathe to Relax. It's a really good one, and you can set the length of the inhale, you can set the length of the exhale, and I think you can set the duration of time that it guides you for. So you can do them for 5 minutes, 10 minutes, and that's Breathe to Relax, I think the number 2. So hopefully that could be helpful. Migraines.
Can low stomach acid, this is a good one, I think, Mike, you can probably tackle this, or we can tackle this one. Can low stomach acid have an effect on hormones?
Yes. That's a cascade. Zinc is required for the production of stomach acid. Zinc is also requires adequate stomach acid to break it down. This is just one aspect that could play a role in that. So most people have low stomach acid. We talked about that last night, I think. And so you have low stomach acid, you're not going to get a lot of things from your food, like iron, zinc, other minerals really require a lot of stomach acid. Vitamin B12 requires adequate stomach acid. So you're going to be missing out on those things. And some of them, like zinc, is required to actually make the stomach acid in the first place. Also, it's involved in testosterone. So zinc deficiency can go there too. But when we have the low zinc, then we have the low stomach acid, then we get less zinc, then we make less stomach acid, and it can start a cycle there outside of everything else with hormones. Corey, are you back? I see his face, but I don't hear him. So that would be one way that stomach acid could affect hormones. It could also allows more different types of pathogens and invaders in, which then is a added stress on the body, and any stress is going to negatively impact sex and steroid hormones. other deficiencies. Stomach acid, low stomach acid as a whole has a huge cascade. I'll post a really good article right now that I know I can find quickly that has stomach acid information on all of that stuff if somebody follow it a little later. This is from Michael McAvoy, who was one of our presenters, talked about detoxification. But I posted a link there for a whole bunch of stomach acid information. All right, I'm sure he's trying to jump back on.
Yeah.
I apologize, folks. When we're doing these and all these presenters are all on the road, and it's just stuff that happens in hotels and on the road.
Yeah.
Right. He'll hop back on when he can. Let's do, let's look at, where are we at, Joe?
Joni says, it's another migraine question, but I know someone suffers from horrible migraines, have a ton of allergies, but eats wheat thinking they're okay with it. What would you think about that?
I don't know. Joni, do you mean like allergies, like allergic to cats, dogs, pollen, wheat, or like things, environmental allergies, or food allergies? Regardless, I guess it doesn't really matter, because if someone has a lot of allergies, they've got gut issues. Allergies start in the gut. Imbalances of Th1, Th2 immune function, which we talked about a lot Monday night with Quran. So if that gut is inflamed, wheat obviously is going to probably be the top thing on their list, which is going to further cause permeability issues and inflammatory immune problems, inflammatory cytokines, and things that are going to trigger those allergies. The allergies are just the body responding to something as if it's a threat that's not. And that goes up exponentially when you have that inflammatory situation in the food reactions, with gluten from wheat being by far the #1 most common in that situation. But I've seen people's... Corey says he joined the call.
Okay, yeah. Yeah, so it's hard to convince someone that wheat is a problem when they don't experience digestive disorders. So if they're having different types of allergies that manifest themselves somewhere else in the body, or it's migraines or something else, and you tell them their problem is wheat or gluten, it's kind of a tough sell if they're not really ready to hear that. So as far as what I would say, I guess I would suggest to eliminate it for a period of time, maybe 60 days, and see if that makes a difference. But ultimately, if they're not ready to hear that and not ready to experiment with that, there's just really not much you can do or say to that person.
Yeah, I've seen people's allergies clear up when they go gluten-free, but as long as they're not adding in a ton of like crap food, which tends to happen, like Jen Fugo talked about on her interview, tend to add in a bunch of crap food when we take out gluten. But I've seen a lot of people's allergies. The megaspore that we talked about the other night, that's the most powerful thing I've seen with allergies, seasonal allergies, pet allergies, asthma. I've seen lifelong allergies and asthma clear up within a month with that, because of the way it modulates the immune system. But that's my first go-to with any type of allergies at this point. But I would definitely do the wheat, and not just the wheat. I would look into
general elimination diet: corn, soy, wheat, dairy.
It's gluten, dairy, corn, soy, and eggs. Is eggs included in a normal elimination diet? I think so.
Not always, but
not always. But those are the top culprits. And corn and soy weren't on the list until they all started being genetically modified, and then now way more people have allergies to them. But that's unrelated. So
Elizabeth says, we'll be able to continue to access all the Q&As after this week if we bought the modules. Yes, we're gonna replay all the ones that we have recorded, and then we're gonna do new ones at least once a month, new Q&As for everyone who's in the Primal90 system. So if folks want to take a look at that, primal90.com. But hold on, should we make that announcement now, Mike? Since Dr. Schuler is still trying to get back on?
Sure.
I'm here,
Sure.
guys.
Oh,
Oh,
you are back. All right, cool. So hang
Can
tight,
you hear
folks.
me?
We do
yeah,
have
yeah, yeah.
later on. All right, excellent. So
I hope you haven't been sitting there long.
You're rolling, like that's great.
Did I mess anything up?
no, I don't think you messed anything up.
All right. All right. It's still choppy, but we'll see what we can get.
Go ahead, Mike. You want to find another one?
Yeah. Let's
You
see.
did the stomach
Waking
acid
back
one.
up. I think he has adrenal fatigue, gut issues, cortisol, sugar, sleep. Wow, this is a loaded question. We'll see. We'll see. We'll test his audio here. From Jan, my question is about chronic stress. My husband has sleep issues, waking around 3 a.m. and can't get back to sleep for ages. I think he has adrenal fatigue, has gut problems too. I'm thinking low blood sugar plus subsequent increasing cortisol wakes him up. That's a good detective work, Jan. That's actually really common. Will reducing sugar in his diet help him sleep through the night? I can get him to take supplements but not change his diet. I want to demonstrate a result through a simple diet modification. He also fits with the moody and easy to anger in his early 50s.
Dr. Corey, did you catch all that?
Cool.
Cool.
Yep, I caught all the question. Can you hear my answer?
Yes.
So far, so good. Yep.
Okay. So I would look at something that has a really powerful effect on mood first, because we see mood change probably first. So it's really hard to address all those things at once, but actually that's kind of what we do, right? We have to do a reboot on a lot of people. But there's, like, I would probably use something like Lavella, which is a product that I use very
It's so funny. It cuts out right when he says product names. Can you? It does. It was like rolling, and then you said a product, and it went blah, 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 blah. So, can you hit up that product again?
The product is Lavella.
Lovella.
Lavella.
L-A.
L-A.
Okay.
V-E-L-L-A.
Just one L.
Okay. And all right, keep rolling. I just wanted to catch that before you went through your whole answer and had to go back.
Yeah, it's been studied in generalized anxiety.
I don't.
Went head to head against days Ativan, in fact.
Went head to head with Ativan?
Also, we saw
I don't.
Yeah, I'm really sorry, folks. You know, we're doing our best to bring you some really good stuff here, but sometimes the internet just does not like us.
no.
Yep, I
just
think
heard you
so.
say no.
Okay. So I was talking about Lavella and the studies with Ativan and Paxil.
Uh-huh.
Okay. So in a situation that has lots of different physiologic dysfunction and, you know, adherence is going to be a challenge, I would go with something that was studied without changing everything. And Lavella was one of those things. All they did was give Lavella at 80 or 160 milligrams, which is just 1 or 2 soft gels per day. And we saw results in about a week. We saw the biggest result within 3 weeks. And sometimes just having that effect will change a person's sleep in and of itself.
Who makes that? Is that a name brand or?
Yeah, what exactly is Lavella?
Yeah, it's actually a German. It's a German phytopharmaceutical. In the States, it's sold by Integrative Therapeutics in the professional channel, and I think there might be one through. I'll have to look up where else it's available. But it's a German company. Schwaba is the parent company that makes and sells it.
Okay. Is it something that's like available on Amazon or something like that?
It'll be available. It'll be available for purchase if you that word up, Lavella.
Okay.
You go on to another one. I'll find that.
Okay. Yeah, actually, I just got it actually. I'm on Amazon now. All right, let's see.
Okay.
We have a couple of Megasport
We'll talk
questions.
about.
We'll talk about that later. Yeah.
Dr. Schuler, do you use Megaspore Biotic?
I have not yet. It's on my list to consider.
Mm-hmm.
Okay. I'll put you in touch with Karan, the microbiologist. It's fascinating stuff.
Yeah, for sure.
Hormone imbalances, low digestive enzymes. Here's here's a good one. Mary Ann, I have hormonal imbalances and low digestive enzymes. My practitioner has me on 60 milligrams of zinc liver chelate, standard process, and Zypan. I'm about 90 pounds. How much of this supplemental zinc can safely be taken at once in one meal? I'm trying to have my middle meal with the zinc as the others have the antagonistic calcium. Is there a zinc safety level? And would it vary by weight?
There is.
60 milligrams is a lot of zinc liver chelate.
Yeah.
I can't hear.
No, I can't either. I'm sorry, folks.
Okay.
All right. That's more zinc liver. I use those products myself, actually, both of them. That's more zinc liver chelate than I've ever taken or had somebody take, but I don't know your medical history. I don't know your practitioner's plan. I don't, for 90 pounds, that seems like a lot of zinc to me, but I'm not about stepping on people's toes and questioning
Mm-hmm.
protocols and things when I don't know a background at all. But taking it in the middle of the day should be fine. Some people get nauseous from high dose zinc, even lower dose zinc, so I think all at once should be fine, but if you started to get nauseous or have a weird reaction like that, it would probably be best to split it up. Joe posted the link to the Lavella.
Mm-hmm. What do you think about Botox injections to stop tension headaches? I've heard of that before. I don't have an opinion on that, though.
Botox injections?
Yeah, for tension headaches. There's Corey. He'll have an answer. I've heard they were effective, but I have no opinion on how safe or the long-term use of something like that.
I've never heard of that.
Yeah.
Corey, are you back?
I think I'm back.
Sorry, man. I know this is frustrating for you too. It's frustrating for everyone. Botox injections for tension headaches. Has it been proven effective?
I wouldn't use the word proven, but some people do really well with it.
Really?
Mm-hmm.
Yeah, especially so a lot of times headache issues are caused by eye strain, and so people, especially who have had strabismus or cross-eye issues as children, come to adulthood and have really bad migraine headaches, and now Botox is routinely used for strabismus. So it makes sense to do intraocular Botox potentially for migraine headaches.
Okay. Or any long-term negative effects with that?
Probably.
Yeah.
Yeah. Well, it's not. It would be my go-to, but and I definitely wouldn't say it's proven again. But we don't know the details yet. We haven't had it on the market all that long.
Okay. Cool. That sounds like a good answer.
Michelle, I think, yes, I like Dr. Schuler's answer about maybe the 3 causes. I think when he was talking about inflammation and hormones. My migraines, it keeps moving when I'm trying to read it. Where did it go? Oh, my migraine auras are probably hormones since I had partial hysterectomy at age 30. Hot flashes started at 40. Still going on age 65, but refuse to take any pills, parentheses, hormones. Comes in handy when cold outside. At least you have a good sense of humor about it. That's good to see. Yeah, when I lived in Chicago, I kind of wished I could have hot flashes. Yeah, I would say with your history of hormonal issues that you might have found your culprit. Do you see?
Let's see.
Looking.
How can one best absorb liquid supplemental vitamin B12 or vitamin B complex? I have pernicious anemia.
Yeah.
Did I say that right?
Usually intramuscular injections are necessary for that. Although I have found sublingual vitamin B12 to be fairly effective. I go as high as 10,000 micrograms per day for that.
Would that be? Would you determine the type of B12 based on that individual, or would you prefer like the methylcobalamin or hydroxy or?
The product that I use uses a methylcobalamin, and I haven't had people have problems with it. I know that some people kind of get scared about using too many methyl donors, but I haven't had issues with it yet. I'm probably just lucky.
Okay, so a sublingual, but the intramuscular injections. Can you explain just briefly pernicious anemia? Because people who don't have it and they're hearing this question probably have no idea what it is.
Yeah, pernicious anemia is actually an autoimmune disease where the immune system attacks the ability to absorb B12 through something called intrinsic factor, and so
It's
it's
intrinsic
an autoimmune disease. So really, Did you lose me or did I lose you?
For a second. Now you're back.
You're back.
Okay, good. So pernicious anemia is an autoimmune disease, and it causes anemia, B12 anemia, and people get super tired. And B12 anemia is a big problem because it can cause irreversible nerve damage.
Okay.
Come in again. Whoever asked about stomach acid earlier,
Yeah.
low stomach acid production leads to low production of the intrinsic factor there, and an almost complete inability to absorb B12.
Which happens way further down in the gut.
Yeah, but it starts a chain reaction. Yeah. There was a question I answered when you were gone about stomach acid, so I figured I'd throw that in there.
Cool.
Got it. Thank you. PS100. What is PS100? Lowered my cortisol from low carb.
So phosphatidylserine.
Low carb.
Yeah, that's phosphatidylserine, right?
Phosphatidylserine. Yep.
So phosphatidylserine, that's something people I think it's gotten too popular in Facebook groups and Google, for example, that people self-diagnose themselves with high cortisol all the time and then pound down phosphatidylserine, and because it's a good cortisol lowering. Do you use it in your practice?
I use it all the time, and the reason that I like it is because of the wide therapeutic window. So in athletes, we use 600 milligrams of phosphatidylserine, and so physical stress causing hypercortisolism.
Interesting. To keep the cortisol spike down from the training?
Yes, correct.
Interesting. Okay. Yeah.
Okay. I never. That makes sense. Yeah. For high nighttime cortisol, it works really well to help people sleep. That's the only time I've used it. That's interesting.
Yeah, take it at night.
What was that?
I would definitely take it at night.
Yeah, you mix that one up and you might have a rough morning. It dramatically lowers cortisol. The problem I mentioned that I've run into is people who have, once they test and find out their cortisol levels, their levels are actually low. They just have feelings of anxiety and stuff, so they think it's high, and then they're pounding down phosphatidylserine, and I've seen,
They feel worse.
Yeah, they're just driving it further low. So I mean, it's something, if you're going to take it, I just generally either have testing or make sure you're high to begin with. What is the best natural way to reduce testosterone levels in women? That's a good one.
I have, yeah. So high testosterone levels in women aren't necessarily, but are often likely related to polycystic ovarian syndrome, and PCOS in its core is inflammation to the ovaries. We think it's primarily inflammation caused by insulin resistance. However, it can be other things too. So are women who don't have insulin resistance at all, but still have ovarian dysfunction, and it's usually a food sensitivity or something like that. But if I had to have one product, there's something on the market. Feminescence. Feminescence is really helpful for women with polycystic ovarian syndrome. Other things that are really, really good, though, are inositol, and N-acetylcysteine is probably a secondary thing. But then I also like berberine. Hey, it came up again.
There you
Berberine.
go. Okay. I think when one of the times you left us there, someone had a question about the fight or flight triggering tension headaches.
Her question was that her husband has fight or flight, like stress-triggered headaches, especially if he gets woken up from sleeping. It triggers like a migraine headache, and I told her just some breathing exercises to switch from sympathetic to parasympathetic that I knew, so I didn't know about headaches in specific, but that was her question. If he gets woken up or has any other stressful jarring, I guess I would call it, he gets a headache like immediately.
Yeah. See if there's a meditation practice or a yoga practice or a breathing practice, because those are the things that impact that the most and most significantly. And if he's already doing that, then now we have to dive, because it could be something that sort of misfiring, and then it's not something that we would self-diagnose and self-treat.
Got you. Did I answer your question, Elizabeth?
Yes. Let's see here. Rhodiola. There's one rhodiola with a question mark. Is rhodiola something you use?
Most days, yep. And the thing about rhodiola is it's used for like inner tension or anxiety oftentimes, but some people feel like they get anxious on rhodiola, and the small consensus among people I know is that oftentimes if you have sort of that adverse effect or the unwanted effect of getting more anxious or more stressed or more tense with rhodiola, it's that you're not taking enough, which is totally counterintuitive, but something that we could pay attention to. So oftentimes I'll go as 400 milligrams of rhodiola is a really common dosage for me, but a lot of people are using less than that and getting ill effects.
Interesting. Yeah, I have like a rhodiola ashwagandha. Are you familiar with innate response?
Yeah, I am familiar with them.
Yeah, I've used their adrenal. I think it's called adrenal. I don't remember what it's called, but it's like the typical adaptogenic blend. Rhodiola, ashwagandha. I think there might be a schizandra in there, and one other, but. Yeah, those are nice because they seem to usually help people that are high-strung calm down and help people that are fatigued to have a little more energy.
Yeah. So I think we're going to take just a couple of more questions here, and then we'll get to some other announcements.
We've got one from Jessica that we didn't catch. It seems to be on there. It's old.
Okay.
And we might have even done the follow-up to this question without asking the question. I am a 30-year-old female who had a hysterectomy at 23 years old due to ovarian cancer. I was placed on hormone replacement therapies for several years, but decided 1 year ago to stop taking hormone replacement therapy. Now I am going through surgical menopause. I am experiencing numerous problems, but the main two are short-term memory loss and inability to handle stress. Even the smallest amount of stress, I become anxious. I even had to quit my job. I understand there may be a lot of different answers to this question, but I would like to know in which direction I might want to start looking. I've been to so many different physicians. Even my gynecological oncologist tells me he has no idea why I'm experiencing these symptoms. Also, I understand this is for men, but if you have any suggestions, I would be so grateful. This isn't just for men. We've talked pretty equally tonight. But Jessica, first off, nice work with beating the cancer.
Yeah.
And yeah, Dr. Schuler, you have any thoughts on that situation?
Yeah, this is like my wheelhouse. This is where I really like to spend time. So we could have done the whole deal on this one. There's I really like the Evanescence product that we talked about for PCOS is what I would use here too, because it doesn't introduce hormones from outside the body, but does actually help with some of those issues. And post-hysterectomy, brain fog is super common. And so and the reason for that is that estradiol itself is actually impacts the number of dendrites that grow off neurons. So it actually improves the interconnectedness. And as soon as you sort of turn off that faucet, you start losing interconnectedness of neurons. So why brain fog wouldn't be a really common effect and wouldn't everybody know about it is beyond me. It should be very well known. So that would be where I would start. But there's also there's some really nice kind of brain nurturing components here, like acetyl-L-carnitine. You can do in fairly high dose and get nice effects. There's a mushroom called lion's mane that's kind of on the expensive side, but very, very helpful. I use a product for this called the ProThrivers Wellness Brain, and I like that. It's actually post-cancer treatment, and it's post-cancer, cognitive dysfunction. So that's what I would use for that.
ProThrivers, what was that again?
ProThrivers Wellness Brain.
Okay, cool. Got that, Mike.
I take L-carnitine, acetyl-L-carnitine. I've had 5 concussions in my life. Diagnosed 5 concussions. I don't know how many. I don't ask. There's stories behind them, but I don't need to embarrass myself on TV.
That explains a lot.
It does explain a lot, but I've noticed I had not really severe symptoms or anything yet. I'm more in a precautionary, preventative type of approach right now because I don't want to develop the conditions that are often associated with lots of concussions. So I looked into acetyl-L-carnitine. I take the Designs for Health one, but I take it every morning, and I've noticed a lot of improved mental clarity. She says, thank you so much.
Yeah, you're very welcome. That was a great answer.
Yeah. Let's see.
Joni says, what's going on if you wake up and immediately start shaking and having hot flashes? Is it similar to the man's issue with waking up and having that sort of that headache?
Would depend on the stage of life. You can have a hot flash in reproductive years, you can have a hot flash in perimenopause, and a hot flash in postmenopause, and they're totally different answers.
Wow, interesting.
So if she's still there, how old is she?
Yeah, how old are you, Joni? We'll come back to her if she answers.
So I'll just start. Postmenopausal. Waking up with postmenopausal hot flashes that's a really common vasomotor issue. So usually things like black cohosh, evanescence comes up again here as well. Blood sugar problems. So this is a really cool thing. Not really cool, but it's cool for nerds like me. Is that we find that the women who have the most trouble with taking hormone replacement therapy post-menopause are the ones that entered perimenopause with blood sugar regulation issues. So if you can get your kind of the blood sugar problems under control when entering perimenopause, if you have hot flashes and night sweats come, you're gonna handle that a lot. So the it's unfortunately really difficult, but handled fairly well because postmenopause is just a loss of hormones. And so we lose hormones. We first lose our ability to make progesterone, but then we lose our ability to make estradiol. We kind of forget about that sometimes. And then we have these relative problems, like relative and relative dominances of certain hormones. And so getting a kind of a full hormone metabolite panel is a fair test to understand kind of where you're at, and we can work on. It's a perimenopausal hot flash. That's a different animal altogether, because perimenopause is a time of hormone instability where women are making either tiny amounts or huge amounts of hormones instead of this like nice trickle flow that comes out. So kind of creating that stability usually is related to a diurnal pattern or a circadian pattern, but it can also be just simply an HPA dysfunction. So those are the two places we'd start. The last place we start, or not the last, but the third place we would go is liver function for those.
Cool. Okay. How does one avoid potential nerve damage if one has... Oh, it moved. Oh, we did this one already. Okay, sorry.
No, we didn't. No, this is a different...
This is a different pernicious anemia?
It's a follow-up from the pernicious
okay.
anemia question.
Okay, yeah, so how does one avoid potential nerve damage if one has pernicious anemia, like I do? I am once very healthy, but now unhealthy 38-year-old lady. I still want to be able to walk around and not have any nerve damage.
So once the nerve damage is there, it is irreversible. So you need to keep your vitamin B12 levels high. So if you have to do the sublingual, but once it's there, it's going to be really difficult. Actually, it probably is impossible to. I don't like saying the word impossible, because the human body can do crazy things and regenerates all the time in ways that we don't really ever expect. But we learned in school that B12, long-term B12 deficiency does cause permanent nerve damage, and so you can stop it by keeping won't get you this has already happened.
So monitoring the levels, possibly injections, and definitely sublingual if that's the route. This is a good one, Joni. She was postmenopausal, by the way, that was asking the question, but you covered that really elaborately, so that's great. Which test for hormones do you recommend? Like, what form of test? Do you like blood? Do you like saliva? You know, what type of hormone testing do you do?
When it comes to sex hormones, I stick with blood usually. I don't have a lot of confidence in salivary hormones. They do tell you a story, but they do require extra interpretation, and they're at much lower concentrations, so there's more room for error with saliva. I actually really like urinary sex hormones. I think that's really a cool way of doing it. I use Meridian Valley for that, because you can get a really broad test. You can look at all the different metabolites, and that's when I really get to nerd out. It's fabulous. And but for stress hormones, you know, I actually like saliva. I use that the most frequently, but I'm really into the urinary cortisol as well. The new Dutch test is really cool, and I like that a fair amount as well.
Excellent. We'll do a couple more quick ones, and I think we're going to let Dr. Schuler go. Do you have a particular company that you like for sublingual B12, or B sublingual in general?
Do I have a brand?
Yeah.
Is that what you said?
Yeah. Do you have a company or brand that you like?
I use Protocol for Life.
Okay.
And if you can't find Protocol for Life, you could probably find one from Now Foods.
Okay.
I used to live down the street from their headquarters and distribution center in Elk Grove, Illinois.
Yeah.
Sounds cold.
Bright orange bottles. Yeah, it was cold. But there literally is an elk grove there filled with elks in a giant pen that you can go, and they're big.
Wow.
Yeah.
That's interesting.
Yeah, I just always wanted to eat them, and you can't eat them, so it wasn't that exciting for me.
A point. All right. Let's tackle one more here. I have Hashimoto's. Can feminescence help with low thyroid?
That was part of the studies that were done on that product. I use it pretty frequently, but if you have Hashimoto's and you're taking thyroid medication, you have to take it 1 to 2 hours apart from feminescence. So generally, if you're taking Synthroid or Armor, you can't take any food with it anyway. So I recommend taking it. I like the 2-hour time period. The company says 1 hour apart, but I just find it a little bit easier to go at least 2 hours from your thyroid medication.
Cool. All right.
All right. Dr. Schuler, thank you so much, and I'm sorry about the traveling and tech issues and stuff.
Yeah.
We'd love to have you back on for another webinar pretty soon and do another live Q&A maybe when you're at home or in the office, and we could get a little more smooth of a process here.
Mm-hmm.
Yeah, let's do that.
Oh, this is actually one more, if you can.
Yeah.
Mom has been suffering from shingles neuropathy for years. Can B12 help end? What is the highest dose of methyl B12? Any other suggestions?
Sort of end with a hard one.
Brain it all relaxed, thinking he's getting off easy.
Yeah, the B12 dose I use is 10,000 micrograms. Will it help? I have no idea. Maybe. I know that the common approach is something like lysine, but these are kind of these latent viral infections. They're nasty, and they take a really comprehensive approach to getting rid of them. One of the things that I like, that I think is really cool, is Loricidin, which is the brand name of Monolaurin, and that stuff is awesome. I use that a lot for those types of nasty infections. If you just had to pick one thing, that's where I would go with it.
What about low-dose naltrexone for something like that?
Yeah, I mean, I like low-dose naltrexone for almost every autoimmune disease and latent infection that I can think of. I've never had anybody report bad effects from it, but I'm not prescribing it, but I know people are using it.
Okay. Cool. That was
right.
a great answer for such a complicated question. All right, I think we're definitely going to have Dr. Schuler back, so especially for folks who are in the Primal90 system, we'll definitely have him back, and hopefully we'll find a way. Maybe we'll find a way to get you in person and do this without any internet.
Yeah, you going to San Diego or New York anytime soon?
Yeah.
I'm everywhere. Yeah.
Okay.
All right. Cool. Yeah, when you're out here or out there, hit one of us up. We'd love to do a live segment.
Yeah, that'd be awesome.
Yeah, we should do that for sure.
Cool. Look forward to it. Dr. Corey Schuler, I appreciate it very much. We all appreciate it. We thank you so much for your time.
All right, bye guys.
Thanks. You, Corey.
Bye-bye. All right, folks, that was awesome. I'm sorry about the tech issues, but like I said, we'll definitely have him back. Hang out, because we're
learning adaptability, Joe. We're learning how to work on the fly, and we're getting thrown to the fire and answering questions. We're learning.
Yeah. So, if any, who was here from the last show of hands, so to speak? Say hello if you were here on the last webinar.
I know Joe, or someone else named Joe, but.
So. We're going to try and give something away for just the folks who join us on the live webinars. And today's no different. I don't have another cooking workshop. So for those of you who were here last time, I gave the cooking workshop away. That sells normally for $67. So we're not going to do that again because I haven't even gotten to the ones that bought last time, and so I have to go through a bunch of emails and get that to people, so I can't do that again. Maybe we'll do that another time. What I do have is a discount code for you to use if you want to go check out the Primal90 system. So I'll put the website in here. If you go to primal90.com and hit the checkout page, the price is $147. That's the discounted price right now, and that's going to go up on, I think, Tuesday or Wednesday of next week. It's going to go up to the regular price. But if you go there and go to the checkout page and type in the code P90Webinar50, P90, all lowercase, P90Webinar50, it's going to take $50 off the 147 price. So it actually is going to bring it down to the original price we had it for like 24 hours, $97 tonight. And again, that's just for you guys here in this webinar. Take $50 off Primal90 system. For those of you who aren't familiar with Primal90, it's going to be 12 weekly modules. Each module is a different subject. Each module goes in a specific order, so you get through the system in a way that makes sense. You tackle the things that need to be tackled first, and then second, and then third. And those modules you have lifetime access. I had a couple of questions today. People were like, "Is it going to be live again? Do we have to tune in?" No. Every module you have lifetime access to it, and it's going to be a one-time payment for you guys tonight, $97 if you use that code. And that's it. You're in the system, and that's it.
It's less than I charge for an hour of consultation time.
It's less than I spend on coffee a month. So
I don't drink coffee.
Yeah, you have lifetime access to that. You can start back at the beginning if you want and get done with that. We'll be updating those. And
all the interviews, Corey's interview, all the other interviews.
Yeah, 32 interviews. You're going to get free access to all the interviews, and in fact, those interviews, you'll notice that those interviews all of them were on slightly different subjects. Some of them were on wildly different subjects, but that was all on purpose. They actually all fold in to the modules themselves. And so the thing we wanted to do is make sure that we didn't leave you hanging. Like, we wanted to give you all the information we possibly could from all these amazing experts. But then it's going to be, what do I do with this information? And that's where the modules come in, and that sort of continuing education comes in. You're going to be able to take that information and really put it into some really great practical use. And so we're going to have other videos in there. We're going to have downloads and checklists and guides. We left no stone unturned. So it's the most comprehensive system that I've ever seen. And you're going to get a lot of benefit from that. There's 5 pillars to this. So it's the interviews that you've been watching for the past month or so. It's the modules, the 12 weekly modules. We spread them out once a week too, so it's not, again, if we dump 12 modules and all that information on your lap all at once, it would be too overwhelming, and that's exactly what we want to avoid. We don't want anyone to feel left out, overwhelmed, feeling like it's too much and I'm just not going to do anything, because we get that a lot.
With the summits, that's what happens usually.
Yeah, exactly. You get so much information and you just get overwhelmed, and a lot of people we've heard that, someone said that in the last webinar, I feel so confused and overwhelmed that I end up doing nothing. So that's exactly what we want to avoid. So it's the modules, it's the 32 interviews, it's the monthly Q&A, so we're going to continue to do these at least once per month, bring back experts from Primal90, introduce you to some new experts, and we're going to do these live Q&As. Most of the time we won't have the tech issues that we had tonight, but we're going to continue to do those. There's going to be the meal plan and recipe system. We have someone designing this an amazing system of 9 different meal plans. So there's going to be one for autoimmune paleo. There's going to be for like a lowish carb real food, higher carb real food. There's going to be one specifically for SIBO. There's going to be GAPS diet. There's going to be specific carbohydrate diet. I'm not sure if I covered all of them, but there are 5, in my opinion, real essential meal plans that you need to really complete the whole picture.
And to know which one might be appropriate.
Yeah, exactly.
There's so many different therapeutic diets out there, and you look up therapeutic diet, and it's just overwhelming. And then the diets are confusing, and you can't eat this, or you can eat that, or whatever. And then, I'm a pretty good cook, but when I first looked at, I think it was the SCD, when I was trying to help clients through that, and they'd say, well, what do you eat on this? And I was like, well, I've never done it. So I looked
Right.
at the food list, and it was hard to come up with meals and to prepare, because it was so far outside of the normal food I was cooking that, I got my staples, man. I know what's in the kitchen, and I buy the same similar stuff, and kind of go through a series of things I generally cook all the time. And when I had to go outside of my comfort zone, it was tough, even if you are a good cook. So, and how to work without or with certain ingredients you're not used to. So the meal plan.
FODMAPs was the other one. There's FODMAPs and low histamine, which are really tough.
Yeah,
really
those
tough
are both
to
really
navigate.
hard diet plans to do. So thank you, Bonnie and Joe and Marianne.
Welcome. Yeah, we have. In case you couldn't tell, we actually have a lot of fun doing these. It's a little stressful sometimes when we have some tech issues, but we have a lot of fun, and this is really what we're passionate about. And we've spent the last, between all of us, 20 years, really teaching people and helping people really take control of their health, and thousands of clients between us helping people with all sorts of things. And everything that's in the system is what we teach our clients, and we've just poured it all out on the table, everything. Lots of blood, sweat, and tears that went into this, over the past, 2 years, really, since Mike really started working on it, but 8 or 9 months since we really started working on this specific product for you guys. So I hope everyone takes advantage of that again. When you check out P90 Webinar 50, and you're going to save $50 off the product. So go check that out. Does anyone have any other questions? Looking forward to the high-carb diet. Nice.
Yeah. Me and Joe, we talked about it last night. We've both been on a relatively high-carb diet for the last couple months since this really ramped up and the stress levels are really high. A lot of times when you're under more stress, whether it be excessive training or any kind of stress, you need more carbohydrates. A lot of people do, and both of us, without talking to each other, I started eating more rice, and white rice is generally. I started eating more. We get these. They're like small fingerling potatoes. We have a produce CSA here that's kind of like whatever they bring us, but it's a small little fingerling potato. So more potatoes, more rice. I'm a freak. I love pumpkin.
I love pumpkin too.
I love it. I bought it for my dog when he was sick a couple years ago because they sell it at the pet store in a can, give this to your dog. And then one night it was in the fridge, half the can was still there, and I was like, I like pumpkin, I'm gonna try this. And
so basically you ate dog food?
I ate the dog food, but it's just pumpkin, so it's not really dog food. And I was like, man, this is great. And I'm eating it, and I look at the dog, and he's all like, what are you doing, man? This is my food.
That's my food.
So now I always have a case of pumpkin. That's my go-to carbohydrate for post-workout if I do a workout session or after surfing when I actually go. I love just a nice can of organic pumpkin. Now, canned food isn't going to be as nutrient-friendly as, fresh pumpkin, but fresh pumpkins aren't available year-round, so it's pretty convenient.
Yeah, good question from Bonnie. Does high carb raise cortisol and thus weight? Actually, high carb would more than likely lower cortisol. There may be some other issues with high carb. Depends on what you mean by high carb, but carbs in general, cortisol rises when your blood sugar goes too low, and so that would be a reason for your cortisol to actually go up, because one of the jobs of cortisol is to raise blood sugar. But if you've got some blood sugar dysregulation and you're eating super high carbs, particularly if it's processed carbohydrates like Twinkies, you may have a blood sugar crash at some point after that, which would raise cortisol. But in general, I wouldn't necessarily say that carbs raise cortisol.
Yeah, carbs is I actually just made a video on that for this program. They get demonized, and Deb, I love kabocha squash. My fiance introduced me to them, and they're great. We just can't get them all the time. Carbs, it's more the processed sugar, the sweetened beverages, the sodas and things like that. Potato. If people have metabolic issues, sure, and we're going to help people try to figure out where their metabolism is at. We're creating kind of I think we're calling it a speedometer. Thanks, Joe. I like the hat too. We're calling it a speedometer that you kind of follow to try to figure out where your metabolism is at. So, when I lived in Chicago, it was recently as last year, I did really well on a low-carb diet. Even when I was training, not super low-carb, but more protein and fat and less carbohydrates, I did better. Body composition-wise, how I felt, energy levels. Now I am here in San Diego, and since I've been here, I've eaten a lot more fruits and vegetables, more rice, more potatoes. I am more active. I don't hide in my house for 8 months because I hate cold weather. I'm a baby, so I literally didn't do anything active. I would go to the gym, but just going out and about for walks and things I didn't do. And so I think that has a lot to do with it, but people's metabolism changes. What's great, people lose weight on super low carb. they'll lose 20 pounds and then it plateaus and they start to feel like hell and their hormones get shot.
Mm-hmm.
Or, they add carbs back in, they feel better. Other people who have blood sugar regulation issues, and that can stem from inflammation, toxicity. We'll break down all the reasons why people have blood sugar issues and how to fix it. But if you have blood sugar issues, obviously the rice and potatoes and things, until you get your metabolism fixed, isn't going to be a great issue.
Right.
So, I mean, it's so individualized. If there's someone out there selling you a diet that tells you it's perfect for everyone, they're either misinformed, they're selling something that's not, they're just selling something, I'm going to leave it at that, or they're lying, because it's impossible. As different as we look, we're the same different as we function. And so I've seen people do great on both extremes. And so kind of, I don't know if that was answering something, but yes. And we'll talk about that too. I mean,
I don't like the idea of demonizing any sort of major food group. So it's sort of, we've spent the last 50 or so years demonizing saturated fat. So I don't think we should be doing the same thing to carbs.
But the government just told us that cholesterol is okay now.
Yeah, exactly. We finally.
Oh my God, that is going to be looked at as like the biggest scam in the history of just wait another 10 years until like more and more and more and more keeps coming out on statin drugs and cholesterol. Yep. Somebody better go to prison.
Yeah, of course they won't.
That's all I got to say. No, they own the prison.
Yeah,
so,
exactly. So, one more time, Primal90.com. Put in P90 webinar 50 and you'll get it for $97. That's going to be, I'll keep that open for the rest of the night, I guess. It's well, geez, it's almost quarter to 11 here on the East Coast. But
keep it open till midnight, or
I'll keep it open maybe to midnight on your coast, Mike. And
hey, Michelle, you just mentioned lucky you moved to San Diego. Yes. I don't like to use the word luck often, but I feel very grateful to be here. She's from San Diego. Can't get any organics here. I don't know where you are, but we're going to have a ton of resources. That's what we haven't even talked about. There's resource guides and stuff that we.
Oh yeah, the Buyers Club too.
Buyers Club. You just mentioned Pete's Paleo. She just mentioned Pete's Paleo. Pete's Paleo is a member of our Buyers Club. So our members will receive discounts on Pete's Paleo, which is a meal delivery service. We have Paleo to Go, which is another meal delivery service. We have thebrothery.com, Chef Lance Roll, the flavor chef, the best man in the business with broth, delivered, discounts on that. We have Nick's Sticks. We have Jerky's Gourmet, which is some awesome local beef jerky here to San Diego, grass-fed, really good. Squatty Potty, tons of different clean cosmetic and skincare and personal care products. So that's going to be discounts, and we're trying to include companies that ship or make their products available anywhere so that they're useful for everyone. But we kind of just went through the list of stuff that we like and that we like to use that we found is really good, and contacted them and said, hey, we're putting together this thing, and we'd like our members to get discounts with your products. And they said, sure. Yeah. So that's basically how it's going to work.
The idea is you use some of the discount codes and some of the coupons, and you'll pay for the program in no time. I mean, that's kind of why we did it.
For sure. I know Carlton Nutrition is on there with nutrients and some other multivitamin stuff. Megaspore Biotic, which has been like the star of the event so far. We're getting questions on Megaspore even when we're not doing Megaspore webinars. But actually, if that one's still there, I could answer it real quick now if that person's still here. But let me see. But yeah, so the Buyers Club is going to be awesome. Right now, I think that we got 26 companies in there, but I'm always going to be trying to add things. You know, if you hear join the discount club, that's for Joe. You want to talk?
Yeah, Primal90 members. That's what you get that as part of the Primal90 package, and the price, the discounted price right now is normally $147, and it includes those 12 weekly webinars, 12 weekly modules, which is going to have additional videos. It's going to have downloads and resources and checklists. It's going to have folded into it. The second sort of part of this is the 32 expert interviews. People like Dr. Corey Schuler, who's here tonight, Karan Krishnan, who's we talked to the other night, Jordan Reasoner. We did cooking segments with Caitlin Weeks, Kirsten Alana. We talked
Alethea Smith.
Oh, that was really good. It was how to cook a week's worth of meals in an hour.
And she runs a service too that she does meal planning for like I think she
20
teaches you
dishes.
how to make a month's worth of meals in like 4 hours or something, and then
Yeah.
freeze them.
hmm
Super cool.
Yeah. So primal90.com, and then check out with the coupon code P90 webinar 50, and you'll save $50. It'll bring it down to $97. So within that system is where that buyers club is, and we'll be sending you the coupon codes and that buyers club sort of thing next week. So that all comes out. I think the modules come out in about a week, and I think the 15th is when the first module comes out. And the reason we're doing that is just so we get a lot of people sort of on the same page, and sort of we're all going through this together. That gets you into the buyers club. And then the meal plans come with that, the 9 different meal plans with something like over 200 different recipes and all that. So it's no brainer. we've made it as absolutely simple and easy as possible for everyone to get in, and then it kind of pays for itself once you're in there. So let's see. Cool.
Josh asks discount on green superfoods. I will look into that.
Yeah, we can definitely contact. Like I think almost 90% of the people we contacted said yes, and with some pretty significant discounts. So.
Yeah, the companies that haven't agreed don't do discount codes for anything, so they're just stingy
Whatever.
humbugs. No, and we are going to make a ton of product recommendations as well, like not product services, anything that we think would be helpful, because I've spent I don't know how many hours just scouring internet and trying products and trying this and trying that, like my rebounder over there. There's different things that I've spent, Joe's spent, Diane spent a lot of time, experimenting with, looking for things, and we've going to put together, each unit will have resources, we recommend this or this book or this thing, and we're not only recommending products that are giving us discounts for our people, if
Right.
not, they just go within that module, where the Buyers Club will kind of be separate. So, yeah, we're going to make lots of recommendations to try to save you the time. I mean, what's more important than time? So try to save you the time of experimenting. Like, if I had $1 for every thing I bought that didn't work out or whatever, I mean, it's we're going to save you the time and the frustration.
Yeah, cool. All right, folks. I think we're going to wrap on that because it's going to be
it's late o'clock on
past my bedtime. Yeah, there's several experts that we talked to who talked about how important sleep is, and so you'll get a chance to go back and watch all those videos again as much as you want. You'll have lifetime access to everything that's in the Primal 90 system. But I'm gonna get in trouble from some of them for staying up so late and not having my orange glasses on.
Yeah, orange glasses.
Yeah, cool. There you go. All right, folks. We are going to do. When's the next module? When's the next webinar, Mike?
The next webinar is being aired on Saturday.
Right, ladies'
evening.
night.
Ladies' night.
With Diane and Danny J and Stephanie Rupert, and they recorded it, but we're going to show it. We're going to show it on Saturday.
All things women's hormones, women's health. Me and Joe aren't allowed.
Yeah, we weren't allowed there for that. We're not allowed.
So that one, Monday night is Dr. Sachin Patel, who's awesome. If you missed his interview, really great stuff. We're going to talk all things weight loss. And then Tuesday night, we're doing a marathon webinar where we answer your questions until you stop asking them.
Right, or one of us passes out.
Or all of us pass out.
Right, exactly. That's how we're going to close this thing out. So you'll get the you'll get the invitations to all those too, just like you got them for this. So thanks everyone for hanging out with us. And I've got another question here. Oh, I use those glasses on the mountain bike too. Yeah, that's a good idea. Cool. All right, folks. Have a great night. Thanks so much for hanging out. We'll talk to you soon.